As the world started to lead a normal life after 3 years of the pandemic and its heavy toll, the US is once again grappling with a new set of COVID 19 variants. The late summer surge in COVID cases has affected schools, workplaces, and local governments as the number of hospitalizations continue to rise. The US Centers for Disease Control and Prevention (CDC) this week recommended that everyone 6 months and older get an updated COVID 19 vaccine to protect against the potentially serious outcomes of illness this fall and winter. Updated COVID 19 vaccines from Pfizer BioNTech and Moderna were said to be made available later this week. CDC, in its fresh update, said vaccination remains the best protection against COVID 19 related hospitalization and death. Vaccination also reduces your chance of suffering the effects of long COVID, which can develop during or following acute infection and last for an extended duration. The virus that causes COVID 19 is always changing, and protection from vaccines decline over time. CDC Director Mandy Cohen said, "We have more tools than ever to prevent the worst outcomes from COVID 19. Last week, the US Food and Drug Administration (FDA) approved new formulated COVID vaccines from Pfizer and Moderna that are more closely targeted to current variants of the disease. The new COVID vaccines target the XBB.1.5 variant, which was dominant when vaccine makers began to formulate and test a new version. They are monovalent because, unlike the earlier boosters, they do not include protection against the original virus that caused widespread infections 3 years ago." The new vaccines arrived as the US saw a 16% jump in COVID 19 virus related hospitalizations. The CDC data last week showed an increase in hospitalizations, a trend that began rising in late July. The World Health Organization (WHO) also warned of concerning trends for COVID ahead of winter. While there is not currently a single dominant COVID variant worldwide, the EG.5 Omicron subvariant is on the rise. The highly mutated BA.2.86 subvariant has also been detected in 11 countries. In the US, health officials are urging people to get vaccinated as soon as the shots are available, amid growing concerns about the effects that the triple threat of respiratory viruses, coronavirus, flu, and respiratory syncytial virus could rise this fall and winter season.